Good afternoon. The first item of business this afternoon is portfolio questions. The first portfolio is Rural Affairs, Land Reform and Islands. I'd advise the Chamber there's a lot of interest in supplementaries. I'll try to get in as many as possible, but the questions will need to be brief, as indeed will the responses. I call question number 1, Murdo Fraser.
Thank you, Presiding Officer. To ask the Scottish Government what action it is taking to address the reported concerns of stakeholder organisations within the Muirburn Code Working Group regarding the commencement and practicalities of Muirburn licensing.
Minister Jim Fairley.
NatureScot have been working closely with stakeholders through the Muirburn Code Working Group to ensure that the concerns have been accounted for in the development of the Muirburn Code and the licensing scheme. And I'm also due to meet with stakeholders represented in the Muirburn Code Working Group who are concerned with the content and the conditions of the Muirburn Code and the associated licensing framework on the 4th of June. Whilst I understand some stakeholders have concerns, the Code as associated licensing framework have been introduced to ensure that Muirburn is undertaken in a safe and environmentally sustainable manner.
Murdo Fraser.
Can I thank the Minister for that response? It is now very clear that NatureScot's approach to Muirburn licensing is unworkable and is causing serious concern amongst stakeholder groups. 8 organisations representing all different sides of opinion, including Scottish Land and Estates, NFU Scotland, the Scottish Crofting Federation and the Scottish Gamekeepers Association, have now written to the Minister on 2 occasions about this matter, proposing good faith solutions to help ease the burden associated with surveying land for peat depth. The current surveying requirements define peatland as peat where peat is deeper than 40 centimetres, but no national survey data exists at that 40 centimetre threshold, rendering the peatland maps produced by Nature Scotland completely meaningless. So, can I ask the Minister if he will give urgent consideration to temporarily amending the definition of peatland to reflect the 50 centimetre peat depth threshold, which will considerably assist land managers?
Early stages of this process, but the legislation went through at 40 centimetres. There are a number of tools that are being used in order to gauge the difference between the 40 and the 50 centimetres. But as I said, I'll be meeting with the Muirburn Working Group next week, and those issues will be raised in air then.
Briefly, Jackie Dunbar.
Presiding Officer, can I ask the Minister what reassurances the Government is able to provide to land managers regarding the implementation of this legislation and ensuring that NatureScot work with land managers seamlessly to ensure that the legislation is workable and the vital management tool of burning is accessible? Minister.
Well, NatureScot have been working closely with land managers since September in 2023 to ensure that the legislation is workable in practice. They have produced the methodologies to identify the peatland and the non-peatland areas. These have been made available to land managers to allow them to prepare for this legislation coming forward. A simple application process has been developed and feedback has been sought from the stakeholders. Users have tested a prototype and feedback is being used to ensure that the process is user-friendly. Further to this, NatureScot have agreed to allow practitioners to fulfil the training requirements of the legislation by only completing the online part of the Muirburn training course this season to provide more time for the practical elements to be completed. And NatureScot will remain on hand to assist those looking to apply for a Muirburn licence. And as mentioned in the answer to the previous question, I'll meet with the concerned people next week.
Briefly, Colin Smith.
Could the Minister give a commitment, though, that there will be no delay in implementing the new regulations due to be enforced from this April? I'm really concerned about his comments on peatland. I mean, can he categorically rule out changing that threshold from 40 centimetres to 50 centimetres? Because we haven't even implemented what was agreed by this Parliament.
Minister.
There are no plans to change anything at this stage.
Beatrice Wishart.
Thanks, Presiding Officer. Given the importance of the Muirburn in its role with managing fuel loads to mitigate wildfire risk and the timescales that we've heard about, what is the Minister going to do to ensure that licensing applications are as informed and accurate as possible?
Minister.
I'll just point out to the member, in the interest of brevity, I'll point out to the member very quickly that protecting from wildfire is a licensable purpose for the licensing of Muirburn.
Thank you. Question 2, Rose McCall.
Thank you. To ask the Scottish Government whether it will take action to deter wildlife crime on beaches, particularly over the summer months.
Minister.
The Scottish Government works with a number of partners to raise awareness of the wildlife crime, and Scotland is part of Operation Seabird. And that's a police-led operation which focuses on the disturbance of marine wildlife across UK coastlines. The Police Scotland wildlife crime officers will be proactively patrolling coastlines in the summer months, engaging and educating the public and recreational tour operators, as well as enforcing legislation introduced to protect our sea life. So if a member of the public is concerned that they have seen someone commit a crime, they should contact Police Scotland.
Ros McCall.
Thank the Minister for the response. Tentsmuir Nature Reserve in my region welcomes a huge number of visitors every year. And whilst many of the visitors are respectful towards wildlife, some visitors remain unaware that their behaviour or conduct may negatively impact on the animals and could result in them committing a wildlife crime. For example, there was a recent reported incident in which a couple walking their dogs disturbed seals and caused panic and distress for the seals who sought refuge in the sea, which could potentially cause harm. So further to the Minister's response, what more can the Scottish Government do to ensure that the public is fully aware of the risk of inadvertently committing a wildlife offence? And will it consider further public awareness campaigns over the summer months?
Minister.
Well, as I said, Operation Seabird is a national operation. It's focused on disturbance of marine wildlife across UK coastlines. And Police Scotland will be asking our wildlife crime officers to proactively patrol their divisional coastlines in the summer months and engaging with and educating the public and enforcing the legislation introduced to protect their sea life. That proactive engagement will be made with boat or tour operators and members of the public who engage in seaside recreational activity, and to ensure that they are adhering to the relevant legislation.
And briefly, Eleanor Whittam.
What more can be done by the Scottish Government to reinforce the message that those visiting beaches, like those in my Carrick, Cumnock and Doon Valley constituency, must act responsibly and not interfere or inappropriately interact with wild animals when they encounter them in and around our seas? Our beaches are very busy. I think this issue actually must be tackled early and in the school setting as well.
Minister.
Whether folk are visiting beaches, forests, local parks or any other outdoor space, we expect them to act safely and responsibly when they encounter wildlife. And the Scottish Outdoor Access Code sets out useful guidance on minimising disturbance to wildlife, and we ask that everyone familiarises themselves with the steps that they should take to ensure that they are enjoying the outdoors appropriately. With regards to our coastline, the Scottish Marine Wildlife Watching Code provides further recommendations and advice on responsible wildlife watching.
Question 3, Stephen Kerr.
To ask the Scottish Government what new action it will take to support fisheries in the light of the EU-UK agreement.
Cabinet Secretary Mary Goujon.
As set out in the programme for Government, we will continue to champion and support Scotland's world-leading fishing sector to maximise fishing opportunities and modernise, delivering technical and management improvements through the Future Catching Policy and our Inshore Fisheries Management Improvement Programme. The EU-UK trade deal agreed by the UK Government disadvantages the Scottish catching sector. The deal merely perpetuates the arrangements that had been agreed by the previous Conservative Government and their failure to protect our fishing communities. That's why I'm calling for a fair share of the Fishing and Coastal Growth Fund budget allocation to be devolved and administered in partnership with Scottish stakeholders, reflecting the size and importance of fishing to Scotland.
Stephen Kerr.
Well, that answer confirms that the SNP Government doesn't have a clue whether it actually supports Scottish fishing, because on the one hand, John Swinney has said the UK Government has surrendered the Scottish fishing industry, but on the other hand, he's campaigning to rejoin the European Union, which would result in a return to the disastrous common fisheries policy, which is even more damaging for Scottish fishing. So what is worse for Scottish fishing, the sellout by the Labour Government or the hypocrisy of the SNP?
Cabinet Secretary.
I'd say it's the sellout of the Tories and the UK Government. Yeah, exactly. Now, the Tories would like to touch on our position when we're an independent country, which I'm more than happy to talk about and to set out. And we've actually set out our position quite clearly in a paper that we published. Mr Kerr might like to take a few moments to read it as part of the Building a New Scotland series, where we talk about our marine industries and talk about the benefits of Scotland as an independent country, independent in its own right, with a seat at the negotiating table in the EU. Because one thing is for sure, we can negotiate for our own interests there when we're independent, because whether it's Labour or Tory, the UK Government can't be trusted to do it.
Briefly, Gordon MacDonald.
Following Brexit, the Tories delivered a disastrous deal to our fishermen, and Labour has locked them into the same deal for 12 years, and something both parties should apologise for. Can the Cabinet Secretary set out how the Scottish Government has supported fishers and fishing in coastal communities over the course of this Parliament?
As briefly as possible, Cabinet Secretary.
Thank you, and I want to thank Gordon MacDonald for that question, because we are committed to supporting our fishing sector in Scotland, and we have a strong track record when it comes to that. Now, we've set out our overarching policy as part of our future fisheries management strategy and the delivery plan, which we actually published a couple of months ago, to set out how we are delivering on that. And of course, since 2021, we've continued to invest around £9 million each year in our science capabilities, which underpin the important work that our catching sector do. And then on top of that, we have the Marine Fund Scotland, which has delivered over £55 million to over 300 projects since 2021. So we have delivered for our Scottish fishing industry and our communities, and we'll continue to do that.
And Rhoda Grant.
The distribution of fishing quota remains in the responsibility of Scottish ministers. Therefore, can I ask how the Cabinet Secretary will ensure that this public asset remains in public hands and is used to ensure that inshore operators and new entrants have better access to the industry, and it is leased in a way that ensures that cases of modern slavery and human traffic are consigned to history?
Cabinet Secretary.
There are a number of matters, important matters, which Rhoda Grant has raised in her question to me there, that I'm more than happy to follow up specifically on. We did consult on some of those matters recently, and of course we always aim to do that in a fair and equitable way. But in relation to some of the substantive matters, I'm more than happy to follow up in writing.
Question 4, Ash Regan.
To ask the Scottish Government, in light of the Crown Estate in England, Wales and Northern Ireland being granted borrowing powers so that it can, for example, invest in energy infrastructure, what is its position on similar powers being granted to Crown Estate Scotland?
Cabinet Secretary.
Further detail on the arrangements under the Crown Estate Act 2025 won't be known until later this year. The Cabinet Secretary for Finance and Local Government has written to the Chief Secretary to the Treasury on these matters to stress the importance of there being parity of treatment for relative Scottish bodies, including in relation to any borrowing and investment powers which may be afforded to the Crown Estate.
Ash Regan.
That sounds as if Scottish ministers are seeking those powers to be granted. So if that's the case, then some questions, I think, would need to be answered. Before ScotWind auction was delayed, the maximum cap was set at just £75.6 million, only to increase tenfold weeks later after hiring consultants, and it secured Scotland an extra £680.4 million. Global comparisons suggest that even this final figure was substantially undervalued. So can the Minister explain on whose advice did Crown Estate Scotland, a wholly owned public body, come within days of losing out on that substantial increase in revenue, and whose potential benefit was this initial undervalue?
Cabinet Secretary.
The member raises questions again. I would have to follow up in more detail and look into that matter. Of course, the member and no doubt others across the chamber will be aware of the vital role that the Crown Estate has in Scotland in really trying to maximise the value from its assets, many of which we continue to benefit from. And when you look at the monies that we receive from the ScotWind process and the investment that results on the back of that. But I'd be more than happy to follow up with Ash Regan in relation to the specific point that she's raised.
Question 5, Pam Duncan-Glancy.
To ask the Scottish Government what engagement it has had with Glasgow City Council regarding support for the reported development of community food production and short supply chains, as outlined in the Glasgow City Food Plan.
Cabinet Secretary.
We have engaged with partners involved in the Glasgow City Food Plan during the development of our first National Good Food Nation Plan, which covers all aspects of the food system, including community food production and short supply chains. We look forward to working with Glasgow City Council as they develop their future Good Food Nation Plan, as will be required by the Good Food Nation Act.
Pam Duncan-Glancy.
I thank the Cabinet Secretary for that answer. And to tackle food insecurity in Glasgow, the Council is looking at new models like buyers' consortia and local supplier cooperatives that can help grow food closer to where it's needed. They're already doing work in that space, so can I ask the Minister, will the Government commit to working with the Council and other urban councils to embed these models in future rural and agricultural policy?
Cabinet Secretary.
I want to thank Pam Duncan-Glancy for asking that question, because I think she raises some really important matters there. And I think everything that you've outlined there and that the member has outlined there are all matters which I think we would really want to see as we're, I've talked a bit about the Good Food Nation plan and when we should be introducing that to the Scottish Parliament shortly. But I think this is exactly the type of thing that we would like to see and encourage. So more than happy to follow up in relation to that, and also to ensure that my officials are engaged in that work and seeing what else we can do to further support that and see the spread of that across Scotland.
Thank you. Question 6 has been withdrawn. Question 7, David Torrance.
Thank you, Presiding Officer. To ask the Scottish Government what assessment the Rural Affairs Secretary has made on the impact of a UK-EU agreement on Scotland's rural economy.
Minister.
Thank you, Presiding Officer. We very much welcome the UK Government's attempt to rebuild the relations with the EU following what could only be described as a disastrous hard Brexit that the people of Scotland never voted for. We have unceasingly called for an improved relationship, and the UK-EU summit, unnecessarily constrained by the red lines that are self-imposed by the UK Government, are actually a step in the right direction. Many of the details of the agreement are still to be negotiated, never mind actually implemented. Meanwhile, the effects of Brexit, including on our own rural and island economy communities in Scotland, continue to make any sense of congratulation wildly premature. As a start, if they were serious about addressing the scale of damage done by Brexit, the UK Government would immediately discard their self-defeating red lines on a single market, customs union and freedom of movement with our European neighbours. And given how much the actual implementation of the agreement will require devolved competencies, the UK Government's first action should be to engage proactively with the devolved government, including here in Scotland.
David Torrance.
While the agreement, which goes some way to improving some of the harms of Brexit, has got to be welcome, can the Minister highlight for his Chamber how remaining outside the single market and the customs union and without freedom of movement continues to damage the interest of our rural economy?
Minister.
The red tape that increased costs to businesses has hit Scotland's trade with our largest international export market, and Scotland's rural economy bore much of the impact through that loss of EU funding, the new barriers to trade and through reduced access to labour. The Government's own figures show that this deal will be add 9.9 billion to the UK national income by 2040, just 0.2% of the GDP, and the loss of GDP caused by Brexit is estimated to be 20 times that, at 4% of the GDP, according to the Office of Budget Responsibility. So there is no good deal in this for Scotland without being an independent member of the EU, and that gives us unfettered access to the markets that we're looking to be part of.
Question 8, Douglas Ross.
Thank you, Presiding Officer. To ask the Scottish Government what its position is on whether Nature Scott considers and respects the views of local people and businesses when considering applications to control seagulls.
Minister.
Nature Scott does consider and respect the views of local people and businesses, which can vary widely when considering licence applications to control gulls. However, Nature Scott can only issue a licence in accordance with the law. Now, I recently met with stakeholders to discuss how we can minimise gull impacts, which concluded that further actions will be taken this year by Nature Scott to deal with the immediate problem. I've also agreed to chair a summit later this year which will bring together key partners to put measures in place on how to prevent these issues from arising again next year.
Douglas Ross.
Sorry, Minister. Nature Scott do not respect the views of local people and businesses. They ignore the views of local people and businesses. And on Monday, I received a response to a Freedom of Information request asking for the most common reason that licence applications for gull management are refused. And Nature Scott say it is because the applicant doesn't demonstrate that gulls are posing a risk to public health or safety. That is utter rubbish, because I know the people who are putting in these applications and they are at the end of their tether. These birds are causing significant worry, they are physically damaging individuals and they are putting people off going into certain businesses because of their behaviour. So will the Minister finally get a grip of Nature Scott and tell them to start actually delivering for these communities by approving these licences so we can get some control over gulls in our areas?
Minister.
I absolutely accept that there are areas when gulls are causing a problem with public health and safety, and Nature Scott, as the member is well aware, can only issue the licences on the basis of public health and safety issues and not nuisance. And that is the fundamental point that we're trying to get across. Now, if the members want to listen, I've told them on a number of occasions that what I'm prepared to do is intervene when there is an area that needs to be looked at right away, and then I am going to have this summit next year to discuss how we. I will have a summit later this year to discuss with members and the people who are raising these issues on how it is that we control the birds in the way that we need to control them without damaging the population.
Okay, I'll take a supplementary, but can we listen to the questions and then also listen to the responses? Fergus Ewing.
But it's not just public health and safety, Minister. I've repeatedly warned the Scottish Government in this chamber that serious injury or fatality could arise from massive gulls swooping down on elderly and infants, even the consumption of seagull fishes causing horrific disease. After these warnings, a 74-year-old man in Nairn was injured by a seagull. When is the Scottish Government going to get a grip and respond not to Nature Scott, but what do the people say? And at the summit, will it be open to the public, press, MSPs, and with presentations by bids and co-designed by bids? They're the ones that have to sort out the mess, Minister.
Again, I reiterate to the member, I am well aware that there are issues regarding gulls that are swooping and causing problems with people in the areas that we've already spoken about. It is why I made sure that there were licences issued earlier in this year, and it is why we are holding the summit to ensure that we can take measures to protect. We can ensure measures are taken to protect people as we go forward from this point.
Thank you, Minister. Could I please ask members to resist the temptation to shout out while the ministers are seeking to respond? That concludes portfolio questions on rural affairs, land reform and islands. There will be a brief pause while front benches change. We move on to the next item of business. Okay, the next portfolio is health and social care. Again, there's a lot of interest in supplementaries, so brevity in questions and responses would be appreciated. And I call question number 1, Pam Gossel.
Thank you, Presiding Officer. To ask the Scottish Government whether it will provide an update on what action it is taking to improve waiting times for audiology appointments.
Minister Jenny Minto.
Thank you, Presiding Officer. Our 25-26 budget provides record funding of £21 billion for health and social care, with NHS boards receiving an additional £200 million to reduce waiting lists and help support reduction of delayed discharge. With this funding, we will deliver over 150,000 extra appointments and procedures across a number of specialities in the coming year, which will ensure people receive the care they need as quickly as possible. Ear, nose and throat will be an important part of this work, with over £9 million being allocated as part of this funding. This will increase the number of new outpatient appointments available in 25-26 and ensure patients receive the treatment they require.
Pam Gossel.
I thank the Minister for that response. Minister, I have been contacted by one of my constituents who said that her husband waited 19 months for a hearing assessment. He was then advised that he had a moderate hearing loss and would benefit from hearing aids. This assessment took place in October 2024, yet he still does not know when he will be receiving his hearing aids. Meanwhile, my constituent has pointed out that her sister-in-law in Northern Ireland only waited 6 months for an assessment and was able to have her hearing aids fitted in the same appointment. Minister, a lack of hearing assessments and aids can deteriorate one's quality of life. So how can something so simple yet so important take so long?
Always through the chair. Minister.
I thank Pam Gossel for her supplementary question, and she's absolutely right. That length of wait is not the right way we should be supporting people that are having to live with hearing loss. If Ms Gossel would like to write to me directly with regards to that, I'm very happy to look into it, because we absolutely remain committed to a vision for an integrated and community-based service around hearing in Scotland. So if Ms Gossel would write to me, very happy to look into that situation.
Thank you. Question 2, Ben Macpherson.
to ask the Scottish Government what discussions it has had with the Edinburgh Integrated Joint Board, NHS Lothian, the City of Edinburgh Council and other relevant organisations regarding any impact on patients, communities and statutory services of reported reductions to preventative initiatives and services.
Minister Marie Todd.
I, along with ministerial colleagues and government officials, meet with colleagues in Edinburgh on a regular basis. In these meetings with local partners, the Scottish Government continues to stress the paramount importance of putting outcomes for people at the centre of all decision-making. I'm aware of the agreed and proposed actions contained in Edinburgh Integration Joint Board Saving Plan for 25-26, and I'm confident that every effort is being made to ensure that all stakeholders, including service users, are properly consulted and that services continue to provide essential support.
Ben McPherson.
I thank the Minister for that answer, and as her and her colleagues will be aware from the FNQs on the 8th of May and other correspondence before and since then, there is deep concern in our capital city among many charities and third sector organisations, including in my constituency, regarding the review of contracts and service level agreements by the Integrated Joint Board and the Edinburgh Health and Social Care Partnership. The proposed cost savings from the review could lead to loss of really important early intervention and prevention services, which we all know are so important, particularly with the demographic pressure that we have here in the capital. Therefore, I would be grateful if the Scottish Government could continue its efforts and use its convening power to help find solutions to ensure that meaningful engagement and partnership is taking place and that services at risk of cancellation are given the reassurance that they require and are able to continue doing their important work.
Minister.
Thank you very much. I absolutely recognise the concern of the sector in Edinburgh, and I thank the member for raising these issues with us here in the Chamber. But I suppose I must point out that while the Scottish Government has overall responsibility for health and social care policy in Scotland, it is appropriate for IJBs to ensure that social care support services are in place and decisions on how best to deliver services to local communities are ultimately and appropriately for integration authorities and locally elected representatives to make. Edinburgh IGB is in the process of updating its strategic plan, and prevention and early intervention does feature prominently in this. IGB officials have engaged in extensive consultations with third sector representatives, and further decisions on savings have been delayed, I understand, to allow for additional engagement.
Supplementary, Miles Briggs.
Thank you, Deputy Presiding Officer. Monday evening, I attended a packed public meeting organised by Change Mental Health to discuss the concerns many service users have. Given the well-established link between early mental health intervention and suicide prevention, what is the Scottish Government doing to address the potentially life-threatening consequences of cuts to community mental health services here in Edinburgh? And can I ask the Minister, as Mental Health Minister, is she content that Edinburgh would become one of the only cities in Western Europe without community mental health services?
Minister.
So I absolutely recognise the concern of Change Mental Health and their valued stakeholders and partners. I work very regularly with them and meet regularly with them and hear the concerns myself. As I said in my answer to Mr McPherson, these decisions are appropriately and rightly devolved to locally elected representatives to make. And as I understand it, there has been a series of engagements and a pause in the decision-making in order to ensure that appropriate decisions are being made. In terms of the very serious issue that my colleague raises with me in terms of suicide prevention, there is a whole suite of work going on across government to absolutely tackle suicide prevention. We are very focused on that work, and we are very keen to continue the improvements that we've seen over the long term in those particular statistics.
Briefly, Faisal Chowdhury.
Thank you, Presiding Officer. These proposed cuts are causing massive concern, particularly for mental health services, which have been estimated to save £7 for every one invested. The EIJB itself recognised cuts to Thrive mental health contracts could increase pressure on services and leave users without support. Does the Minister agree this goes against Scottish Government target of prevention? Will she meet with me and the cross-party group of MSPs to find a solution?
Minister.
I'm certainly content to meet with colleagues to try to find a way forward. The member will understand, as I've said in previous answers, these are decisions that are appropriately for the IGB and for locally elected representatives. However, the Scottish Government is absolutely focused on early intervention and prevention, including for serious and enduring mental health problems, and we are directly investing for funding in community support both for children and young people and for adults through IJBs, directly through local government funding and also through third sector voluntary funds. And I will make sure that members are aware of these sources of funding for the areas that they support.
Thank you. Question 3 has been withdrawn. Question 4, Liz Smith.
To ask the Scottish Government what action it is taking to support regional NHS boards to tackle the backlogs of complaints.
Cabinet Secretary Neil Gray.
Thank you, Presiding Officer. Overall responsibility and accountability for the management of NHS complaints lies with individual board chief executives, their executive directors and the appropriate senior management. The boards must ensure complaints teams are adequately resourced to meet their statutory duties in relation to complaints handling. And the Scottish Government has been clear about the importance of a timely and effective response in order to resolve a complaint. However, we are aware that not all investigations will be able to meet the 20-day target, and the regulations make provision for timescales of responses to complaints to be extended where appropriate, provided that complainants are informed of the reason for the delay and given a revised timescale for a response.
Liz Smith.
Well, thank you, Cabinet Secretary, for that response. I'm currently representing a constituent who lodged a complaint with the NHS Forth Valley back in October 2024. Other than 3 holding replies up to the beginning of January, my constituent is still waiting. And when I approached NHS Forth Valley, I was informed that because of staff shortages, they were now only working on complaints that were received during August last year, and that it would be unlikely that my constituent would receive a response until at least October 2025. And that, of course, is a whole year after the initial complaint was made. Now, given what the Cabinet Secretary has just said, I hope he will agree that this is completely unacceptable, and it's certainly not within the 20 days that is supposed to be the case for investigation. So can I ask the Cabinet Secretary what action he will take?
Cabinet Secretary.
Thank you. I thank Liz Smith for raising her concerns here around her constituent in Forth Valley. I'm obviously not aware of the full circumstances, so I can't comment specifically, but on the face of it, from what Liz Smith has narrated to Parliament, that is deeply concerning to me, and I would appreciate if she could furnish me with the details of that so I can raise it with Forth Valley to get an explanation as to what is happening there. In general, I would obviously, as I said in my initial answer, expect a timorous response. There can be reasons why that can be delayed, but from what Liz Smith tells me, that has gone beyond that point.
And supplementary, Paul Sweeney.
Thank you, Deputy Presiding Officer. As we've just heard, this isn't just a one-off thing. The complaints that should be taking 20 working days to handle are now being measured in months, not days. This adds extra distress to patients who've had a poor experience with the National Health Service, compounding their stress and turmoil and reducing even further their confidence with the NHS. It also leads to greater burnout within the NHS patient complaints team, as lack of adequate staffing levels leads to backlog and overworking. So does the Cabinet Secretary agree with me that many NHS boards need to allocate more funding to their complaints teams? And if so, will he commit the Scottish Government to making sure that all NHS boards' patient complaint teams have adequate staffing levels to reduce this backlog?
Cabinet Secretary.
As Mr Sweeney will be aware, that is the responsibility, as I said, set out in my initial answer to Liz Smith. That is the responsibility for individual boards in order to make sure that their public affairs and complaints teams are adequately resourced. We are seeing overall the number of complaints decrease from a position in 2022-23 of 33,273, falling down to 33,000, down by 7% from a position of 35,000. So the overall number of complaints is reduced. However, I recognise that the complexity of some of these cases sometimes takes longer for these to be investigated and to be responded to. But the position that I put to Liz Smith of my expectation of complaints teams handling these quickly is absolutely paramount.
Question 5, Sue Webber.
Thank you, Presiding Officer. To ask the Scottish Government what discussions it has had with cardiology patients, clinicians and other relevant stakeholders as part of the development of the recently published long-term conditions framework consultation?
Minister Jenny Minto.
Thank you. The Scottish Government carried out engagement and consultation with a wide range of stakeholders during the development of the long-term conditions framework consultation. This included a heart disease lived experience focus group, a third sector event which was attended by heart disease organisations, and a meeting with the heart disease clinical leads. There have also been ministerial meetings with the British Heart Foundation and Chest, Heart and Stroke Scotland. The consultation is now live, and I would encourage clinicians, health professionals, the third sector and those with lived experience to respond.
Sue Webber.
Thank you, Minister. Last week, British Heart Foundation Scotland published figures that showed Scotland has seen the first sustained rise in heart disease deaths in a generation. We must halt this trend. Collaboration between all of those involved in tackling heart disease is crucial. The long-term conditions framework could result in a deprioritisation of conditions such as heart disease. Will the Minister guarantee that collaboration will take place between these stakeholders and the Scottish Government to ensure the 730,000 people in Scotland living with heart disease are not forgotten about?
Minister.
I thank Sue Webber for her supplementary question and agree that it is important that both third sector clinicians and people living with heart conditions are properly consulted in this. The long-term conditions framework is going to focus on ensuring equitable and sustainable access to the services that all people with long-term conditions need, while still allowing for targeted action on condition-specific care and support where necessary. And that's exactly the message that I passed on to British Heart Foundation Scotland and Chest, Heart and Stroke Scotland. So I agree that we need to continue, and that is exactly the way that I will continue working as we gather information from the consultation.
Thank you. A number of supplementaries. I'll try to get them all in, but they'll need to be brief. First, Carol Mochan.
Presiding Officer, figures published by the British Heart Foundation Scotland last week showed that cardiovascular disease in working age adults aged 20 to 64 in Scotland rose by 14%. The impact of heart disease on people early in life is increasing, particularly in our most deprived areas, where premature deaths are 5 times higher than in our least deprived areas. So will the Minister commit to creating a fully resourced plan to address this, one which is co-produced with clinicians and the third sector?
Minister.
So I thank Carol Mochan for her question, and we are waiting the results of the long-term conditions framework consultation. But I think we've also got to recognise that we also need to go further from the preventative side, and that is exactly where the Scottish Government has been increasing its investment into health. And I absolutely recognise the points that she's made around inequalities and ensuring that people from all areas of Scotland get the right support, which is why we're increasing the number of GP appointments, and also have been working very closely with COSLA on a population health framework which is absolutely focused on prevention.
Briefly, Eleanor Whittam.
The latest figures published yesterday show that a record 149 people in my health board area of Ayrshire and Arran have been waiting more than a year to see a cardiologist. Can the Minister reassure me and the around 13,000 people who are living with cardiovascular disease in my constituency that CVD will remain a priority for the Scottish Government with dedicated resource to support the improvement of cardiology services?
Minister.
I thank Eleanor Whittam for her question and agree with her that we have to focus on prevention of cardiovascular disease, and that remains a priority for the Scottish Government, which is why we have designed a service that focuses on proactive case finding of cardiovascular disease issues. And through our £10 million investment in new CVD Enhanced Service Agreement, we are encouraging innovative ways that general practices can engage with those individuals who may be at higher risk of cardiovascular disease.
Briefly, Jackie Dunbar.
38% of Scotland's population have a long-term health condition. Can the Minister advise how the Scottish Government are working to ensure that outcomes of the long-term conditions framework consultation will build a framework which cuts across all conditions, but also recognise when it's important to be more condition-specific?
Minister.
I thank Jackie Dunbar for her question. As I referenced earlier, the new long-term condition framework will focus on ensuring equitable and sustainable access to the services that all people with long-term conditions need, while still allowing for that targeted action on condition-specific care and support where appropriate. Responses to the current framework and consultation will be carefully analysed alongside other available evidence to help establish opportunities for actions which benefit all people with long-term conditions. Where condition-specific work is appropriate, this will also be informed by evidence, including that from the consultation which is currently live.
Briefly, Pam Duncan-Glancy.
Thank you, Deputy Presiding Officer. And people living with arthritis and MSK conditions make up a large number of people who have long-term conditions. In Glasgow, some of them are waiting for trauma and orthopaedic support for over 52 weeks. So can I ask, what measurable difference will the long-term conditions framework make for people living with arthritis and MSK conditions?
Minister.
Thank Pam Duncan-Glancy for her question. And the way that I have framed the long-term conditions strategy is that I think every condition can benefit from learning from others, and there will be certain things that are golden threads that run through all conditions. And as I've said on 2 responses, that if there are specific areas that require specific strategies, similar to the 10-year cancer strategy that we have, which focuses on certain cancers, then that will certainly be considered.
Question 6, Liam Kerr.
To ask the Scottish Government what its response is to reports that NHS Grampian is ranked the worst of all mainland NHS boards for ambulance delays.
Cabinet Secretary.
Thank you, President Officer. Data on turnaround times for ambulance resources by hospital site and by NHS board across Scotland is shared with the Scottish Government and published on a weekly basis. So we are well aware of the challenges currently being faced both by NHS Grampian and the ambulance service in this regard. We continue to work closely with both boards to improve turnaround times in the region.
Liam Kerr.
Well, the Cabinet Secretary will be aware because he visited NHS Grampian in February, and alongside his usual apology for this government's failure, he promised to improve things. Now, here we are in May, and 1 in 10 people are waiting 4 hours or more for an ambulance, with delays steadily rising. That's nearly double the target figure of 2.5 hours. So what precisely has the Cabinet Secretary done to reduce ambulance wait times at NHS Grampian since February? And when does he project that these measures will result in NHS Grampian hitting its targets?
Cabinet Secretary.
Thank you, President Officer. I saw for myself the challenges that are being faced in NHS Grampian at the Aberdeen Royal Infirmary, specifically as Liam Kerr references from my visit there. I understand the challenges that are there. I've got family members living in Grampian, and so I understand this specific issue intensely. We have escalated NHS Grampian on the escalation framework to level 4, both for their performance and delivery, as well as the financial picture. And so that provides additional support and scrutiny to ensure that they are meeting both their financial imperatives but also their delivery. And top of my list there is the unscheduled care pathways in Grampian, so that they can start to see improvements, because the current position is unacceptable.
Question 7, Martin Whitfield.
Well, Deputy Presiding Officer, to ask the Scottish Government what its response is to the new report from the Royal College of General Practitioners in Scotland, Whole Person Medical Care, the Value of the General Practitioner.
Cabinet Secretary.
Thank you, President Officer. I thank the Royal College of General Practitioners for their report highlighting the value of the GP and the contribution that they make to the nation's healthcare. I look forward to discussing this report further with the RCGP at one of our regular meetings. We remain committed to increasing the number of GPs working in Scotland. In November last year, I published a plan setting out how 20 such measures to improve GP recruitment and retention can be taken forward.
Martin Whitfield.
I'm grateful for that response. The report states categorically the Scottish Government's current target is to increase the number of headcount GPs in Scotland by 800 by 2027. It goes on to say it is the view of Audit Scotland and RCGP Scotland that this target will not be met. Does the Cabinet Secretary agree?
Cabinet Secretary.
I don't think that's inevitability. I think that I am still committed to meeting that target. We've got a record number of GPs currently in training, and I want to work with both the RCGP and the BMA General Practice Committee around how we see increased resources going into general practice to support greater employment. We have seen a rise in the headcount, but I recognise that the whole-time equivalent position has been more challenging post-COVID, where people have understandably taken different work-life balance decisions. I want to see the capacity and the provision from general practice increase, because our vision for the health service is one that has shifted the balance of care into community and primary care. It is a more preventative model. We only arrive at doing that by having increased services within general practice.
Thank you again. A number of supplementaries here. I'll try to get them all in, but I'll need brevity. First, Kenneth Gibson.
Sir, a new 80-bed nursing home is about to open in Largs, with concerns raised about the impact on the town's only GP practice, Largs Medical Group. Despite the practice's proactive efforts, the nursing home allegedly declined to participate in any local agreed enhanced services that would assist in the delivery of sustainable care to its residents. Can the Cabinet Secretary advise what additional support is available to GPs managing a new care home population, and will he join me in encouraging all new care home developments to opt into local enhanced service agreements to address specific local health care needs?
Cabinet Secretary.
Kenneth Gibson for raising this question. As he'll know, the premise of local enhanced services are ones that are agreed on a local basis. It wouldn't be appropriate for me to directly intervene in that, but I do welcome the expansion of social care provision there within Mr Gibson's constituency. We need to make sure that there are good working arrangements between social care and primary care, so I would encourage that to continue. If he continues to see that as being an issue, whilst I can't get directly involved, I would obviously welcome correspondence from him setting out the issues, and I'll make sure that we look into that further.
Sanders Coolhan.
Thank you. Declaration of interest as a practising NHS GP. The RCGP report discloses that adding just one GP per 10,000 people equates to an estimated reduction of over £82,000, with 80 to 90% of patient contact in primary care, but GP only has 7% of the NHS budget. GPs are the cheapest form of healthcare, yet GP practices are in trouble. They have been neglected by this SNP government and are struggling to stay afloat, with Labour's national insurance rise also killing practices. So what is the Scottish Government doing to protect GP practices from going under?
Cabinet Secretary.
We continue to work with the Royal College of General Practitioners, with the BMA's General Practice Committee. We have invested increased investment within general practice through this budget. We've provided increased support to provide support to GP practices on recruitment and retention, though I recognise, given some of the challenges that Dr Gulhani has rehearsed, that their challenges do remain for the recruitment and retention of GPs. That's why I continue to work with the Royal College and with the BMA in order to see greater resource going into general practice, so they can recruit more GPs and wider practice staff and continue providing the incredible service that they do to our communities.
Lee Rennie.
The report says embedding continuity of care into everyday GP practice in Scotland has been under-prioritised, and the GP Voice Tracking Survey found that under half of GPs felt they were able to deliver continuity of care which meets their patients' needs. Now, why, after 17 years in power, are we in this sorry state?
Cabinet Secretary.
I absolutely value the role of that general practitioners play in providing that continuity of care and providing the knowledge and understanding over a person's lifetime often in terms of their health needs. It's absolutely critical. It's why we will continue to work with the BMA and the Royal College to ensure that they do have the support that they need to continue to provide the services to our communities and to provide that continuity of care, because we need to shift the balance of care from acute hospital-based services into the community, into more general practice-based services. That's my vision for the health services, one that I intend to deliver upon.
And question 8, Claire Adamson.
Thank you, Presiding Officer. To ask the Scottish Government how its policies support people with premenstrual dysphoric or disorder.
Minister Jenny Minter.
Thank you. The Scottish Government's ambition is for a Scotland where women enjoy the best possible health throughout their lives. Premenstrual dysphoric disorder, PMDD, is recognised within the Women's Health Plan, including its impact on mental health. Our mental health and wellbeing strategy lays out our vision for improving mental health, so anyone who needs help can get the right help in the right place and at the right time. We expect that mental health care and treatment will be delivered in a person-centred manner to meet each individual's needs, including those affected by PMDD.
Claire Adamson.
Thank the Minister for her answer. PMDD is a severe form of premenstrual syndrome characterised by debilitating psychological symptoms. It's heartening that PMDD is included in the Scottish Government's Women's Health Plan, but research recently by Dr Lindsay Matthews, University of the West of Scotland, and Miss Julie Riddle, University of Glasgow, led the first significant research in this area, and their research indicates a lack of knowledge and understanding among key professionals and services in the UK. Can I ask the Scottish Government to engage with this important research and consider the priorities identified for awareness-raising, training, early diagnosis and holistic psychological support?
Minister.
you, and I thank Claire Adamson for raising this topic in the Chamber. We know that there is still work to be done to address the stigma and lack of understanding which surrounds menstrual health, including PMDD. Through our Women's Health Plan, we've already undertaken steps to raise awareness and support better understanding of PMDD amongst healthcare professionals by commissioning NHS Education for Scotland to create training on menstrual health, which includes PMDD. And our NHS Inform Women's Health platform provides access to information on menstrual health and PMDD for women and girls. I wasn't able to meet with the researchers. However, I know that some of the Women's Health team did, and we are considering Dr Matthews' findings as we develop the next phase of the Women's Health Plan.
Thank you, Minister. That concludes portfolio questions on health and social care. There will be a brief pause to allow front benches to change before we move to the next item of business.